Friends, our guest today is Donovan Pyle. He's the CEO of Health Compass Consulting. It's a health benefits consulting firm which he founded in 2018. He also serves as a senior advisor at the Validation Institute in Boston. And most recently, he is the author of an upcoming book out this November 2025. It's called Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. I love that title, Donovan. Fixing Healthcare: How Executives Can Save Their People, Their Business, and the Economy. Obviously, pointed at corporations, at employers, and particularly at the executives that are running these businesses. So, Donovan, you've been in this business for a long time. You're an expert. You just are coming out with a wonderful book, which I've had a chance to preview. What is the what is the issue? What's the problem in the industry, this part of the industry, healthcare that's targeted at employers and corporations? And what's the idea behind your consulting firm, your book, that you believe can transform healthcare delivery?
Great. Well, first, it's great to be here on a Friday afternoon, and yeah. So, absolutely want to share some insights, and everyone's got their own angle on this industry, and there's a lot of different angles. But for your audience, it's probably familiar, but maybe they're not. But employers cover 164 million Americans with healthcare benefits, and they spend about 1.3 trillion dollars a year. But here's the kicker. About 25% of what they're spending is being wasted. That equals over $325 billion dollars a year, or roughly $4,000 per employee per year
Hmm.
in waste.
That's that's profound. I had not seen that kind of those numbers before like that. I believe it. I mean, that's 25% waste. What is the waste, if you can categorize buckets, or what does the waste do to?
Yeah, so if you look at the JAMA study on this from 2019, the biggest one is what they call pricing failure.
Hmm.
And basically, since most employer plans don't have the ability to see unit prices, meaning how much is the plan actually paying for hospitalizations, surgeries, labs, imaging, and drugs, if they can't see those things, then you really have very little chance of actually managing that healthcare supply chain. And that just creates a massive distortion in the market. And that's why we're seeing such waste, fraud, waste, and abuse throughout this whole industry. To summarize it, hospitals, insurers, and brokers all benefit from rising healthcare costs. They all benefit. They're all on the supply side of that supply chain.
Interesting. Yeah. Yeah. And at the expense of the people the entities or stakeholders that are actually paying, which are the employers. And you
Right,
mentioned
right.
100, I'm sorry, Donovan, 165 million. I think that was there, 164 million Americans get their health care benefits through their employer. And what percentage of the dollars spent in this country on healthcare come through employers? It's in the 40s, pretty close to 50%, isn't it?
A little bit less than that because about 40% of the population is on Medicare or Medicaid, and they spend more per
Hmm.
per participant than the employer sponsored chassis does. But at the end of the day, employers rely on brokers to help them maximize the return on their investment, get the most value for their money. But brokers are not incentivized to do that because,
Hmm.
again, going back to the history of the industry, they the brokerage industry was developed to serve as retail distribution for health insurers. All right. So selling a product and helping a business maximize the return on their investment and manage their healthcare supply chain are two vastly different value propositions.
Well said. Thank you. That actually really captures it. So, what is the approach that you've been taking in your consulting firm and that you outline in the book, perhaps, that could solve this problem?
Yeah. So basically, what we clarify in the book is a six-step process for healthcare transformation. And the first one is really the focus of this book. There may be another follow-up to it, but the focus of this book is on how to get unbiased advice.
Hmm.
Because if you're not getting unbiased advice, you have no chance
Hmm.
of tackling and managing your healthcare supply chain and delivering more value to your employees. You have to get unbiased advice. Most CFOs have no training, no technical training whatsoever in healthcare financing and procurement. Most HR people, HR professionals have no technical training in that area as well. And so they're all relying on their brokers to help them manage this supply chain without fully realizing in many cases that they get paid by the carriers and the PBMs and they're not financially incentivized to do what
The
they want them to
brokers
do.
get paid by the carriers, the insurance carriers, and the PBM,
Yeah,
right? So they're so in a nutshell, the brokers are incentivized and being paid by the vendor, not by the customer.
exactly. And that's a
Wow.
huge it's a huge conflict of interest. So even if, the employer is paying their broker a fee,
Hmm.
the legacy brokerage firms it's estimated if you look at their quarterly 10K earnings reports, they have this wonderful euphemism for the revenue that they get from carriers and PBMs, pharmacy benefit managers. They call it market derived income, MDI. And so, when I worked at a multinational insurance company, brokers were my customers. They were our
Hmm.
leading distribution partners.
Hmm.
And so as I worked my way up through the organization, at one point, I was actually creating the bonus plans, the incentive structures for our top performing brokers, right? I was actually taking them on all-inclusive trips around the world if and when they hit certain thresholds of production. So, I saw this and I saw how that undermines
Hmm.
their objectivity. And it was just, I mean, frankly,
Right.
I was naive at the time. It was just the way, it was just what you did.
One, how your company is different, how you've broken out of that mold and are now being fiduciary responsible to your customer. And again, how do you do that without taking a major financial hit? How do you do that in a sustainable way so that, that would be really helpful. But why don't we start with the Validation Institute? Because I've never heard of the Validation Institute prior to talking to you.
Sure. So yeah, the Validation Institute was born out of GE Healthcare. And the story goes something like this. They were looking for a diabetes management program for their population.
Hmm.
And they were looking at, they're getting proposals from all these, diabetes point solutions that are in the market. And some of the marketing claims were really aggressive. And they said, well, how do we know any of this is true, that these companies can actually produce these kinds of results? So they put together something of a task force
Hmm.
to really do a deep dive on the performance of these point solutions that they were considering.
Hmm.
And that was later spun off and became the Validation Institute. And so really what the Validation Institute does, their core business is evaluating the marketing claims of healthcare point solutions.
Hmm.
And for those that are actually being truthful in their marketing, saying that they produce X, Y, and Z outcomes, they will give them a validation. And it comes with a, financial guarantee, a credibility guarantee, et cetera, et cetera. So that, these companies that are being truthful in their marketing can take that to prospects and show that on their proposals to employers. So it helps them differentiate themselves in the marketplace.
And does the Validation Institute validate? It sounds like they validate point solution vendors, but does it also validate brokers like yourself?
Yes. So this is a huge thing. So I helped the Validation Institute create the guidelines for what we call a fiduciary validation.
Hmm.
So, what I'm telling employers to do in my book and what other people in, my corner of the industry are also telling employers to do is to get unbiased advice. If you don't have that, you have no chance of reducing the waste, fraud, and abuse. You have no
Hmm.
chance.
Hmm.
Um, but the problem, several years ago is that, okay, we're telling employers to do this thing. How do they actually identify management consulting firms that specialize this and have this kind of revenue model and actually serve as a fiduciary to the employer? How do they identify them in the wild? And so we said, all right, let's create some guidelines around this, and let's start vetting these different management consulting firms that operate in this capacity and embrace fiduciary responsibility in their contract with the employer. And so these management consulting firms can differentiate themselves out in the marketplace and make it easier for employers to find them. And so it's still early days, but we've got, I don't know, maybe a dozen or so firms that have been validated on the Validation Institute's website, and it's a good start.
You were making, and other brokers were making serious bucks, and to give that up, what draws someone to say, I'm going to be fiduciary responsible, I'm going to buck the system, buck the market, and actually be responsible to the company, to the customer I'm serving, and not to the seller of
It's
insurance?
it's a great question. I think stated differently, what made you become radicalized?
Okay, in a good way.
In a good way. But I think the folks in my corner of the industry all have had similar types of experiences. So just very briefly, when I was on the carrier side of the business, brokers were my customers. I just felt like brokers were very apathetic around bringing the best solutions
Mm,
to businesses. And I'd go to these open enrollment meetings, and health insurance was always such a pain point. The executives are complaining, the employees are complaining. It's like, man, this is awful. And I kept on wondering to myself, why aren't these brokers recommending at least some of these strategies and solutions that Harris Rosen at Rosen Hotels had pioneered 30 years ago in
mhm,
my own backyard in Orlando? Why aren't
mhm,
they even talking about these things at all? And so I very naively thought, geez, if I just move to the brokerage side of the business, I can start scaling those kinds of innovative solutions. I can start probably help a lot of people, and I can probably make some money doing it. So I went and worked for a national brokerage firm, built a book of business, had some successes, but there was always like this kind of resistance,
mhm,
and a lot of the people like didn't really know what I was talking about when I was talking about steering people towards better, higher quality surgeries, et cetera, or getting
mhm,
drugs at a lower cost through different channels. They just didn't really know what I was talking about.
mhm.
And unbeknownst, completely out of the blue, I was fired from that
Wow.
brokerage firm because
Yeah.
I was, quote, being too hard on a health insurer who happened to pay them their biggest bonus each year.
Right.
And and that was the epiphany for me
Wow.
where I said, okay, this is
Wow.
really at the heart of the matter.
Wow. Donovan, I just, again, I've had the privilege of meeting people like you, brokers and benefits consultants, who are, just incredibly expert in this area, which is complicated. It's a corner of the industry which is not easy to understand. It takes, I think, a long time to actually really get good at it. And it's continuing to change. But the thing about it is, I have to say, it seems to me like you are part of a movement, and a really positive movement in the benefits, broker, health benefits, employer healthcare world. And there's more and more people like you, high integrity, ethical brokers who are saying, we're going to make a good living, but we're going to do it in an ethical way, in a way that's actually in favor of our customers. And I just want to tell you, it just gives me so much hope. I don't know why people like you exist or why you do what you do, um, but I see, I really, over the last 4, 5, 6, 7, 8 years, initially there was only one, and then there were two, then there were a bunch, and now hearing
Yeah.
about the Validation Institute, and hearing how you and others like you are forming your own companies, or having smaller companies where you can actually direct the right thing, the
Mhm.
ethical thing. How could a listener, whether they're coming from an employer they're an employee themselves in a small business, medium-sized business. Um, how could they find out more about what you're doing at Health Compass Consulting or the Validation Institute? Where could people go to find out more about this? And to your point, really understand if their benefits consultant is actually right for them, is actually doing things in their favor.
Yeah, great question. So if you go to fixinghealthcare.com, we have a bunch of tools that we're adding to that site. And one of the first ones that I always recommend executives take, it's an easy entry point, is what we call a total benefits assessment. That assessment will score you into 7 categories of benefits value. From there, you can see identify opportunities, see how you're doing against your peers, and set goals, develop roadmaps, all of those kinds of things. But the first step is awareness. So I'd encourage, your listeners to go take that assessment, especially if they're executives or even employees. Just take it and maybe, pass it along to your CFO and say, listen, there's an opportunity here. Most companies are saving, 1,000 or wasting 1,000 to $4,000 per employee per year. Here's the way out.
Mhm. And in some of in our correspondence, you talked about, between $4,000 to $5,000 per employee per year is wasted, and that in your experience, you're able to save how much for a corporation on average?
Yeah, so going back to 2018 when I started Health Compass, our average customer saves $1,856 per employee per year. And that's by improving coverage and care for the employees, not raising deductibles and all that kind of stuff.
Hmm.
Our lowest performing clients save just over $1,300 per employee per year, and our best performers save over 4,000.
Save over $4,000 per employee per year in healthcare
Yep.
costs. Wow. I think we could end the the dialogue with that. That's really, really impressive. And I, for one, am going to look up fixinghealthcare.com. I'm going to do a deeper dive into your book when it comes out this November, and also going to check out the Validation Institute. Donovan, again, can't thank you enough for what you do, and you make it so clear. I think you just state things so straightforwardly. I've been listening to consultants talk about this for years, and I just really appreciate the way you present it. So thank you.
Well, I appreciate the opportunity. Thanks so much.
Thank you.